Okay, we brought in a spine. This is what our spine looks like, our vertebrae and all that. We're going to talk about first lower back pain, and I suppose lower back pain is one that a lot of people would suffer with, especially if you're maybe sitting all day crouching over a computer in those kind of sedentary lifestyle kind of positions.
That's right.
So let's see our lower back first.
Yeah, so the spine ideally should look a little like this. So it has the three curves built into it, and in the lower back here you can see there's a sort of an inward curve. And if we're sitting a lot, if our posture is bad, if we're slouching, those curves tend to straighten out or flatten out. So we may indeed end up with one curve a little bit like a banana shape rather than that nice S shape that the spine is designed to have. Start by perhaps getting them to move side to side, forward bending, just to make sure that the movements are all normal. You might even look at their posture. You could see perhaps where one shoulder might be higher than the other, or the hips may be slightly rotated.
And would that mean that you're off balance, or you're thrown in one way and your ribs have moved, or?
Exactly.
Okay.
You know, so already just by eyeballing it, you can see where there may be imbalances in the spine.
Okay. I've had some chiropractic work done, and I've felt that kind of click thing.
Yeah.
And what is that? Explain to us what happens when you do manipulate the spine.
Well, the joints cavitate. It's quite a
medical term, okay.
Yeah, but basically you get a pressure change within the joint.
And that balances you again?
It releases gas, that's what the sound is.
Okay.
And then by re-establishing movement, you can reduce spasm, reduce pain, and basically get the person moving again.
Okay.
Absolutely. So again, we spend a lot more time sort of driving, at computers, watching television, and the head very often, what we'll see in the neck and shoulder area is that the head kind of translates forward like that, so we develop a kind of a forward head posture, and
so
that can lead to,
I suppose that's very important, to sit properly and stand properly.
That's right, but very often, yeah, it's this head translation forward which puts strain around the neck, shoulders. Typically that can irritate the joints, the nerves feeding into the arms, and even causing these kind of tension headaches, which is the pain actually moves into the head. Okay,
what would we do for this now? What kind of work would you do for a neck pain?
Well, again, you'd start, depending on the person's tolerance, you might just start with some gentle movements, some stretching. We could even do some sort of traction work, so if you were to lie down, Laura, so we would use palpation to identify areas of tension or blockage. So as you move along the vertebrae, you can feel where there's areas where there may be a little bit of swelling over a joint, and then as you try to move it like that, you may feel that it's blocked. And then you could go into gently mobilizing it, and then if their tolerance is, if they're able to tolerate a little bit more, you could again use a very specific adjustment to free up maybe one or two of the joints in the neck.
That could release pain, and you could be without that headache again.